Hello, and welcome to the Center Show. I'm Jim Layden from the West Springfield Council on Aging and Senior Center. For today's segment, our topic will focus on the Program of All-Inclusive Care for the Elderly, which goes by the acronym of PACE, a model of care for older adults. Joining me today is Selena Conway. Selena is the Enrollment and Marketing Director for Mercy Life, who is responsible for census development and retention, community and referral education, marketing, advertising, and a variety of outreach efforts. Welcome, Selena, and thank you for joining us today.
Great, thank you for having us.
Oh, it's great to have you. Known you in the field for probably over a decade now through a couple other organizations that we both worked for. Why don't you tell me a little bit about yourself and how you got involved with Mercy Life and the PACE program?
Sure. So I've been in Western Mass for about 23 years. I kind of grew up in elder care in that my father owned a nursing home in northern Maine, and kind of came back into it about 10 years ago. I started working for a home care agency, and then an assisted living, and then a nursing home chain. And so when this new PACE program opened up about 3 years ago, I was very interested in it because it was a good way to combine all of the education and skills that I had developed in those previous positions.
Okay. We hear a lot about the PACE programs at the Senior Center. They've become a lot more popular over the years. Can you give a summary of what a program of all-inclusive care for the elderly actually is?
Sure. So a PACE program is it's a model of care, so that's probably the most important thing to remember, that we have a PACE program and there are other PACE programs in the country. It is a program that has its philosophy and the idea that if you really provide increased support for people in the community, you can keep them living at home for a lot longer. So it actually has its roots about 40 years ago out in San Francisco when an immigrant community who didn't believe in putting their parents in a nursing home developed the first PACE program. And that model of care has continued and developed most rapidly in the past 5 years across the country.
Okay. So how is the Mercy Life model different than others?
Well, Mercy Life, the PACE model should be pretty much the same, with through different organizations. The way a PACE model is different than some other models of care is that we act as the provider of all of the insurance. It is a program of all-inclusive care for the elderly. So we provide all of the care, but we also act as the payer. We act as the insurance plan. We are a Medicare managed program, and so we are a Medicare insurance plan for a very small number of people for whom we provide service. So it's quite different than the insurance you or I might have, because all of the people who provide the care work together under one roof to provide very coordinated care for people.
Okay, so the PACE program takes place of the insurance provider.
Yeah, we act as the insurance plan. Okay. What is really unique is that the people who work for the insurance plan also happen to be the providers of care. We employ the providers. We employ doctors. We employ nurses. We employ day center workers because we have a day center. And we employ all of the different providers of care that a senior might utilize in getting their care and trying to stay at home safely.
Okay. So how does somebody become eligible for this type of program?
Okay, so Medicare has particular requirements for the program. And they are that someone would need to be 55 or older. In our case, for Mercy Life, our territory, if you will, is Hampden and Hampshire County. So those are easy. The second two criteria are what would require a lot more conversation. They do need to be frail enough to qualify for a nursing home. Now, our program is designed to keep people from going into a nursing home, but they do need to be frail enough to need that level of service over the long term. Okay. And the fourth criteria is that they do need to be safe in the community with the services that we provide.
Okay. Who determines if somebody's frail or not to be eligible for this
program? Yeah, that's a good question. So every state has different criteria for what is considered nursing home eligible. Okay. So in Massachusetts, we have a nurse who does an assessment tool that is part of the Massachusetts. It's a tool that's used in Massachusetts, and so our nurse does that assessment, and we make a determination which is ultimately approved by the state as well.
Okay.
Yeah.
So what might a typical participant look like that's on one of your PACE programs?
Yeah, so this is a great program for people who are finding themselves unable to maintain that independence that they once had and are needing increased services. So sometimes that will be somebody who is finding themselves going to the ER, being hospitalized, needing a rehab visit over several times, and it becomes sometimes so often that that last rehab stay in a nursing home becomes a long-term stay. Okay. So sometimes we'll have people call us who are recently widowed or don't have other people to help them and are not getting enough coordination or enough services to be able to stay living in the community and are at risk of going into a nursing home if they don't get a lot more help.
Okay. And you did say that the program, it's for Hampden and Hampshire County participants only.
Right, right. So we cover a lot. You know, Hampden and Hampshire County have some pretty far towns that are pretty far
regions,
away
sure.
from our day center, which is in West Springfield, which we can talk about in a minute.
Yep.
But we do cover all of those areas, certainly.
Can you talk about some of the healthcare services provided by Mercy Life?
Right, sure. So a program of all-inclusive care is a great name for this program. It is all-inclusive. So everything that somebody would need to take care of themselves is provided through this program. So that would include primary care services. It would include home care, if that was what was needed. Includes adult day health program, if that's what's needed. It would cover things like hospitalizations or rehab stays. We do provide for medications. We pay for medications and provide them. Okay. Durable medical equipment. So all of this physical therapy, occupational therapy. Our program would even cover things like dentistry, optometry, podiatry, all of the services that people need that are usually covered by medical insurance and more are covered through a PACE program.
And all of this stuff is on site?
Well, except for home care, of course. Yep. So we have a day center facility, which is in the old Brightside Orphanage in West Springfield. Beautiful campus. And we do, in that particular building, have an adult day health program. And we have a medical clinic. So we have doctors and nurses who work right there on site, right down the hall from this day center. And in that building, we also have, as I mentioned, physical and occupational therapy, social services, dietary services.
So with the all-inclusive package, it really speaks of convenience for somebody.
It really does, and it really brings the world of healthcare. It can be overwhelming. It's overwhelming for me. It can really be overwhelming for seniors, and so it kind of brings that whole world down to a much more manageable level. Kind of like if somebody were at a nursing home, but nobody lives in our facility. Everybody sleeps and goes to their own home every night if they come to the day center. That's not a requirement because we also do provide home care. So that might be in the form of a home health aide, providing help with things like showering and dressing and toileting and things like that. Or it might be actually skilled care from a visiting nurse.
You mentioned some of the centers. Where is that and what's there specifically?
Well, the services that I mentioned earlier are there. That's where our kind of home base for our home care staff. Okay. One of the big pieces of our particular program is that we provide transportation. Okay. And we have a transportation department at Mercy Life, so we have our own vans, our own drivers, and those members are part of what we call this interdisciplinary team. The whole reason a PACE program is successful in keeping very frail elders living at home safely in the community is because all of these disciplines work under one roof and talk to each other all the time on a daily basis, sometimes a couple hours a day, about the people in our program and how we can keep them safe.
Right. So can you give an example of a typical day for an older adult attending one of the day centers?
Okay. Well, one thing I would say is that there is no typical adult in a PACE program. Again, another reason why these programs are successful is that every plan of care is individualized to that person's needs. Okay. So there are people who come to the center, there are people who don't. There are people who come 5 days a week, there are some people who come one day, and everything in between. So Often, what a case might look like is that somebody would need some home care in the morning to help them get washed up, dressed, ready to go. So that might be a home health aide that went into the home for an hour. And then our transportation van would come and help, Mrs. Jones get into the van to come to our day center. We have people who arrive as early as about 8:15. Some people are coming in as late as 11. And then they would come in, probably have a cup of coffee, maybe a pastry. And we do have we have a big day center, so we have a lot of things going on all the time, which is really nice. So we do have usually a group exercise program going on, usually have some sort of news and trivia group, so people can choose what they might like to do. They do have a wonderful lunch that is provided by Providence Place, which is our independent living community on the same campus. And some people start to go home in the afternoon. Some people leave as early as 1, but most people are leaving around 2:30, 3 o'clock, some as late as 4. And during that day, they have, often we'll have musical entertainment or crafts. And we also have a pool table.
Wow.
And we have other services provided. So, for example, we have a spiritual chaplain, and so she will provide services a couple days a week that to meet the spiritual needs of our participants, which is really important.
That's nice. So it just sounds like it's a great place for people to come, not only to get medical services, but they can also go there recreational and have socialization opportunities as well.
Absolutely, and that's a big part of keeping people healthy. For some people, they are going down to our rehab gym. They are having occupational or physical therapy. They might be individualized. Sometimes it's with a group with people who have similar health concerns. So it might be an arthritis group, for example. Or they might just be using the equipment in our gym as their Planet Fitness, for example.
And people have the freedoms to do whatever it is that they want to do that day.
Right. Well, they may have a scheduled time to be in the gym, for example. They might have a scheduled time to see a provider because we are checking in regularly with our providers. Or they just may be there purely for socialization that day.
How about for medical purposes? If they wanted to meet with a doctor, they wanted to meet with a nurse that day, do they have the flexibility to do that, or do they have to set up an appointment? How does something like that work?
Well, we try to deal with emergent situations right away. So one of the nice things is that we do have a nurse who works in our day center all day, every day.
Okay, nice.
So I kind of think of it as a school nurse. So there's always a nurse there. She's helping with things like blood pressure and blood sugar checks, that sort of thing, weight checks. She's changing wound dressings, that sort of thing. But if somebody just doesn't feel well, she's right there to help assess, triage the situation. And if it warrants, she may send them down the hall to see the medical providers, the doctors.
Okay.
Or actually, if it's really emergency, the doctor can just walk down the hall to see the person in our day center, which is nice too.
Okay, that's great.
Yeah.
So can an older adult enroll in just part of the program, like home care or daycare?
No, sometimes we're asked that though, because as I mentioned, we have a beautiful day center. It's totally refurbished building, and it's very sunny and bright. And often when people come and tour, or they might have called us because they're looking for an adult day program, and they tour and they really just want that component. But it is an all-inclusive plan, so you either enroll in our program or you don't.
Okay.
So
once you enroll in it, can you disenroll at any point?
you can. So we act as I mentioned, we act as the Medicare provider. So we don't follow the same rules in terms of open enrollment, where you're stuck with an insurance plan for at least a full year. We don't have that sort of model. But because we are asking people to make a big change, we are going to provide all of their care, which means they're changing the providers to our providers. And when we are changing things like your home health aides or your primary care docs, those are not things to take lightly. So we usually move forward with people that we think will want to do this over the long term. But if it doesn't work out, occasionally it doesn't work out. The vast majority of the time, people don't even think twice about their decision. They love being with Mercy Life, but they can disenroll.
That's right. Okay. So you talked about care plan and coordination. So can you explain about the Mercy Life team of healthcare professionals that develops the treatment of the care plan?
Right. So as I mentioned earlier, we are successful because we are small enough to provide care specifically for that person. So how do we know what that person needs? We spend a lot of time prior to enrolling in the program in assessing that particular person's needs. So it's not just a matter of getting medical records from their previous provider. We go into the home and we can kind of really have to have an understanding of how safe the home is, what kind of medical equipment or handrails and things like that might be needed to make the home safe. We know who the family is and who the other caregivers are. We do bring them into the center to be assessed by the social worker, the physical therapist, the dietitian, all of these other providers that I mentioned before, so that everybody gets a little piece of the puzzle.
Yeah, I was going to ask you. I figured, the family and the caregivers are included in the process.
Absolutely, absolutely. They're key. They're crucial because when people enroll in our program, even though we can provide nursing home level support, we have an expectation that the caregivers are going to continue to work with us in providing that care.
And you talked about needs that are tailored specifically to the individual. How often does the plan change, or is it reviewed?
Well, at a minimum, we will look at the care plan every 6 months.
Okay.
If something happens, if someone falls and breaks their hip or a caregiver falls and breaks her hip, we may have to re-examine that care plan because things have changed. And so I would say as needed, minimally every 6 months.
Okay. You talked about how Mercy Life becomes the insurer. That sounds great, but how is the program essentially paid for?
Okay, so we are Medicare provider. So what Medicare does is they pay Mercy Life a premium each month for each person in our program, and we provide care for them. So minimally, in just about every case, Medicare is paying Mercy Life, and in most cases, we are also being funded by Medicaid. In Massachusetts, that program is called Mass Health. Or people can pay privately if they can't become eligible for Mass Health. We have found that there are many, many people who, outside of a PACE program, would not be eligible for Mass Health. But if they meet the criteria for this program, which means they have sophisticated enough health needs, they often do become eligible for Mass Health because the guidelines are different.
Okay.
Yeah. So essentially it's Medicare, Mass Health, or private pay. If you found a long-term care insurance that covered a PACE program, that would certainly be an option, but so far we haven't encountered that.
Okay. And can you just talk just a little bit more about premiums or any out-of-pocket expenses that a program participant may or may not see?
Right, sure. So regardless of how the premium is paid to Mercy Life, it's capitated, okay? So we incur all of the liability. So we are not charging our participants ever a copay or a deductible, co-insurance, that sort of thing, okay? We cover everything 100%. So if somebody has Mass Health, everything's covered 100%, which is very, very nice. If somebody's paying privately, they are paying the premium, but they are not paying any additional cost, even if their needs go up tremendously.
Okay. So if someone's interested in the program, what should they do to enroll, Selena?
So they would call our main number, which is 413-748-7223. Got to throw that in there.
You have a website?
We have a website that contains a lot of information.
Okay.
It's mymercylife.com.
Okay.
And on that website, on the homepage, you'll find a video that really explains the program pretty well and shows the program pretty well, I think. We had a lot of fun making that video with our participants and employees about a year ago, and so we're very proud of that. There's a testimonial section on the website. there is a frequently asked question section there. So there's a lot of information there. But if they really wanted to pursue this, they would just call that number and they would ask for enrollment.
Okay.
And we would help them on that first phone call to kind of assess whether this is an appropriate program for them.
Sure.
We are not signing people, by the masses, and we really kind of want to take our time and make sure that this is a good program.
Yeah. Does the person need a medical referral at all?
No, no.
Okay.
So they are often referred by people in the industry, if you will, because often providers are working with a client that they can help in this one little silo of care that they provide. So, for example, a VNA might be providing PT assistance to someone in the home after an injury. But when they're done, they realize that Mrs. Jones is not really okay now, that she really would benefit from other services. So oftentimes other providers will make a referral to us. Right. So no, anybody could call. They could call for themselves. They could call for a loved one. They could call really just for more information.
Okay. And what if somebody wanted to see the facility itself? Do you give tours and things like
Oh,
that?
absolutely, absolutely. Okay. So anyone who was going to enroll would have been to our center because, as I mentioned, that is part of our assessment process. But certainly we are happy to showcase it for anybody who is interested. Oftentimes that's how families start before they approach the subject with a loved one.
So you would feel that the PACE programs do keep people in their homes for longer periods of time?
Certainly do, certainly do. Now remember, everybody who comes to our program has to qualify for a nursing home, but we have usually under about 8%, less than that, of people who actually go to a nursing home. Sometimes it's inevitable, sometimes it does happen, but we try as hard as we possibly can to provide interventions that will keep people at home and do things creatively. We have the ability to do that in a creative way, and we often do.
Do you have a success story that you'd like to share?
Sure. I mean, we have so many. We had a family a few months back who was not English-speaking, a Spanish-speaking family, and we have a lot of Spanish-speaking staff and caregivers, which is great. And so this person his health was rapidly declining, and the family was becoming quite afraid of their ability to keep him living at home. Really kind of wanted to put him in a nursing home or a hospital for his final days. And that's not uncommon. Sometimes people are just really afraid of that.
Sure.
And so they, at that time, did not have a healthcare proxy signed. And so we were able to use some of our Spanish-speaking staff to go into the home and really communicate in a better way what this documentation was. And they were able to make decisions for this person. And the family was, once they became a healthcare proxy. We really increased the support in the home. So we increased the home care hours. We increased the nursing visits. Traditionally, what people do in those final days often is to transfer to hospice services, which are great, but you do change providers. And so with PACE, because we provide hospice-like services and palliative care, it was the same aides and the same nurses who were able to be with that family in the final moments. Our social worker, who had worked with this family for a long time, was also able to be there in the final hours. And they were just so appreciative that they were able to accomplish this very scary thing when they wanted to honor the wishes of their dad and their husband and that sort of thing, but they really needed a lot of help, and we were able to provide that.
That's great.
Yeah, it
That's
was
what
really
the program's
nice.
all about.
Right, right.
Okay. All right, well, that concludes our presentation for today.
Great,
Thanks
great.
for your time. You did a great job. It was a pleasure having you, and always good to see you, Selena. Thank
Okay,
you.
great, thank you. Appreciate it.
That concludes this segment of the Center Show. I'd like to thank Selena Conway for taking the time today to join us and explain all-inclusive PACE programs, specifically the services offered at Mercy Life. Stay tuned for next month, as we're going to have a panel discussion on identity theft and financial scams targeting older adults. The West Springfield Council on Aging and Senior Center thanks the viewing public for this opportunity. Thank you.